With a history of breast cancer with my mother and aunt, I'm concerned about taking HRT and anything else to help with menopause. Is it okay to take estradiol? A history of sexual desire is 0 and has been for a couple of years.
Yeah, so the very first thing is, as a breast cancer survivor myself, I want you to know that it's super important for you to know your risk of breast cancer so that you can do the proper screening and any mitigation, right? So, number one, if you've got a strong family history, she should get genetic testing, and her insurance should pay for it, and she's a candidate for it, right? Number one. And then once you know that, if you have any genetic risk, then you can then discuss any tools, whether it's surgery or other things, to lower that risk. Okay. But that being said, as I said before, your risk is your risk, and adding hormone therapy does not further increase your risk of breast cancer. So if she's having menopausal symptoms, she should not be afraid to use hormone therapy. The Menopause Society position statement makes this extremely clear. A family history of breast cancer is not a contraindication. And remember, even in the Women's Health Initiative, that gets maligned, but we learned, and I'll critique a lot of it, but we learned a great deal of very important information from it. And I want to remind patients that in that very large gazillion-dollar study of thousands of women, it showed that women who took estrogen alone had a lower risk of breast cancer and a lower risk of dying of breast cancer. And then in women who took estrogen with a synthetic progestin, which we rarely prescribe anymore, had the tiniest, and when I say tiny, I mean tiny, so much that it's actually been argued that it wasn't even statistically significant. But taking it at face value, it was an incredibly small risk of breast cancer incidence, but not mortality. And it was less than an additional one case for every 1,000 women taking it. And then when they looked at family history or other risk factors for breast cancer, like previous breast biopsies, dense breasts, that it wasn't further increased in women who took hormone therapy. So those are really important safety concerns you should know. So I want to know her risk so she can get the best screening, surveillance, MRI, genetic testing, and managing that if necessary. But I also don't want her to be afraid, because remember, we have to look at all the benefits that go along with hormone therapy.